American Academy of Medical Transcription, or AAMT. She's also a consultant for RX Secure Incorporated, a medical coding and billing service company. She graduated dentistry from the University of the East Ramon Magsaysay Memorial Medical Center. Ladies and gentlemen, Dr. Lau Chang.
First of all, good morning, and I would like to thank each and every one of you for taking our time to be here and listen to us and present our capabilities. This is actually the first time that our sector of the IT BPM, which is healthcare, to do trade missions here in the US, though we were attending conventions, conferences, but this is the first time, and we'd like to thank Undersecretary thank you very much for supporting our industry. And also DTI, who's been very supportive, and Mike Ignacio here, the trade representative, for doing all these things for this sector for healthcare. According as stated by the study of Everest of 2013, the healthcare BPM is the hidden jewel of the Philippine global services industry. In 2012 performances, and I believe Mr. Hernandez showed this slide, and there are two items that's very notable in this slide. Is the growth of two sector, the game development, 251% from 2011 to 2012. And for the healthcare information management, we grew by 66% from 2011 to 2012. Well, actually, next slide. If you take a look from since 2010, we grew almost fourfold. And actually, from 2004, when we started, when we started promoting this industry in 2004, we were only about, there were only about, I believe, 12 companies doing only simple medical transcription and coding and posting of bills. But now we have reached the point wherein we have about 150 companies doing healthcare information management, and we're still growing. And we believe that in the next 3 years, 4 years, we will increase exponentially by another 100% or 25% year on year. Okay, if you take a look at these targets, then there are actual declared and projected employment. When we started as an MTRP, we were just an association for doing companies doing medical transcription. So from simple services like encoding and transcribing of reports, we are now doing and expanding our services to do healthcare, almost all functions of healthcare information management. So in 2012, we've reached 45,000, and with a revenue of about $460 million US. And we are targeting about to reach 100,000 full-time employees by 2016, and a revenue of $1 billion US. So that's a very significant numbers for an industry started with about 4,000 10 years ago. Next slide. So what do we really do and what are the services that the Philippine sector is doing? We are actually doing almost anything that are in healthcare information management, and probably some of you are familiar with the services like medical billing, medical coding. But here you will see competencies like in the pharmaceutical industry, the pharmacy benefits management. We're also doing clinical trials, data management of clinical research for telemedicine, teleradiology. We're doing also remote patient monitoring, consumer medical health information, medical education, case management, and of course in the revenue cycle management, we're doing, next slide please. I want to show you the functions and the tasks of in the revenue cycle management, and there are dozens of functions. Can you go to the next slide? Okay. The healthcare revenue cycle management are actually divided for the providers and the payer side. Okay, we are doing some transaction systems, provider management system, payer adjudication system. Next. So we weren't able to remove the animation, and we want to show you all the functions in the in RCM. And if you are working in a hospital, in a clinics, you'll be very familiar with all of this. And yes, believe it or not, most of these functions can be done in the Philippines. And later on, you'll be able to talk to some companies here, and you will see that almost all, most, if not all of these functions can be done in the Philippines, and actually we're doing it. Okay, we are doing also from the very simple encoding, from this very simple posting of bills, data to the most complex fraud and detection and management, adjudication management, and some data analytics. So these are the functions that we are doing in the Philippines. And we have also, can you go back to the previous slides? No, next one. Next. Okay, so how can we, and what are the advantages of this industry? What do we have, and why are we saying that the healthcare information management is the hidden jewel of the IT BPM? This is because of the massive talent pool, about 125 medical professionals we are producing in the country, and about 80% of that, or about 60% of that, are nursing graduates. And you know the fact that for the longest time, that the Philippines is the sources of medical professionals all over the world. So with the 80,000 nursing graduates, 83,000 actually are US RNs, are in the US, are Philippine educated, and most of these are familiar with the medical systems. The average age of medical professionals in the Philippines are around 29 years old, and we have about 200 to 300 underutilized nursing graduates at the moment. So it may be a problem if you come to think of it, but it is an advantage for the healthcare IT BPM. Next slide. Okay, what's the charter, the association, the HIMOA? This is our associations for the healthcare information management. Is to support the development of the HIM BPM sector in the Philippines. Of course, we create and organize the domain expertise, and we always come up with programs for our industry, for our companies, member companies or non-member companies. And of course, the center of our programs is the talent development and mobilization. Okay, in talent development, of course, we are in partnership with TESDA, with the scholarship programs that's been extending to us. We are producing around 2,000 annually of scholars that are being absorbed or employed in our sector of this industry. And of course, the international marketing, we are being supported by DTI. So we're doing, and almost every year we are attending conferences to raise the awareness of the industry on the Philippine capability in the healthcare. And of course, these are the trust. As I've said, the talent development and mobilization is the center and the focus of our programs and our initiatives. Okay, we have about 75 companies and we're still growing, and 64% of these are doing HIM services. And these are, again, from the simple medical transcription to the most complex services like adjudication system, fraud management, and data analytics. And then here I'll show you the logos of some of the companies doing healthcare information management. Okay, we have, of course, you've seen there Accenture, the company where Mr. Hernandez, and of course, you have SPI there. You have big companies also, and Genpact, of course, CXL is here. And of course, most of these companies are actually serving, some of them are serving the Fortune 500 companies in healthcare, hospitals here in the US. And of course, also in the Philippines, some of the companies are also doing or servicing local hospitals. So other markets for the healthcare information management is also the Asia Pacific region is Singapore and Australia and Europe. But of course, it's still about the biggest market for it is still in the US. And you know the fact that for the longest time, as I've said, we are the source of quality medical professionals. And this really the reason why most of the hospitals, even companies here, you know that even in LA, most of the remote medical coders are also Filipinos. And this is only a proof that we can really emerge as Philippines can emerge as the hub for healthcare information management. Okay, thank you very much, and I want to give you the time to meet, of course, our companies and member companies, and to give testimonials as to what they're doing in the Philippines. Thank you very much.
And now, ladies and gentlemen, we will hear from one of the biggest providers of this industry to the world, from the Philippines. I had the fortune of attending their opening before in the Mall of Asia, in that area, with the President Aki, no less, opening for them. So our speaker today is Dr. Jerry Osmond. He's the Chief Medical Officer of EXL Service. Dr. Jerry Osmond serves as Chief Medical Officer and has held CMO and COO positions in nationally recognized companies providing care management, clinical strategies, and IT capabilities to large health plan and provider groups. He also has had over 20 years of clinical expertise as a board-certified family practice physician and medical educator. He brings extensive experience to EXL Service by providing clinical and administrative guidance for software development in care management, core administration, value-based incentives, and value-based reimbursement products for commercial, Medicare, and Medicaid programs. Dr. Osmond has also developed, implemented, and managed quality improvement and analytics programs in multiple care delivery environments, and has provided independent consulting services for several major third-party administrators. And highly respected data management and guideline organizations. Ladies and gentlemen, Dr. Osman.
First, thank you for that introduction. If you could show that to my wife, she doesn't know what I do, so I really appreciate that. First of all, thank you, Mr. Deputy Counsel General and Mr. Undersecretary. I really appreciate being here, and also my fellow speakers. First of all, I'm very informal, so if we catch up later, please feel free to call me Jerry. I'm very comfortable with that. You heard my background. I'm a family doc by background. And as you can tell from this tall, blonde beach boy look, I grew up in California. Actually went to medical school just down the road at UCSF, so it's really great to be back here. I was looking at my picture on the front of the brochure. How did I get so old? You're probably saying, this guy is so old, he was on the committee that helped invent fire. So hopefully that translates into experience and not senility at this point. So the reason I'm here today is to tell you why I'm happy and why I'm excited. And for those of you who don't know me, this is as excited as I get. So just so you're aware of that. I have just one question for Mr. Undersecretary. You showed a picture when you had infrastructure that had one bus and 2 cars. I've been to Manila 3 times in the last 9 months. I've never seen 1 bus and 2 cars. It's usually a little more active than that. So I really want to know, where did you get that picture? Because I'd love to visit that place.
I'll mail it to you.
Yeah, the check's in the mail. Thank you.
It's called Photoshop.
So first of all, I don't know how many of you are familiar with EXL. We're about a $500 million company. We have over 20,000 employees across the globe with a significant concentration in the Philippines. Currently, we have about almost 2,300 employees in the Philippines, located in Manila and Cebu. Cebu is one of our fastest growing areas. As a company, EXL, think of it as about a 3-cornered stool. We perform operations, back room, front room, middle room operations for large healthcare organizations, as well as banking and finance and insurance organizations. We also have a very strong foundation in analytics. And one of our greatest efforts right now, and I have the good fortune to help lead that effort, is really around healthcare analytics, predictive analysis, population health management, and I'm going to come to describe why that's important in terms of the context of our discussion today. And the third portion of that 3-cornered stool is platform technology. We have 3 companies that perform technology. Subrogation is one of those areas, the area of being able to help with actuarial and underwriting. And the one that's most important in terms of the context of our discussion today is the platform capability to perform utilization, case and disease management, and population health management. The old name for that company was Landator. It's currently now EXL Landa. So what companies do, especially large health plans, is they purchase that platform and then perform case, disease, and utilization management on that platform. So within those capabilities, the area of greatest interest that I want to talk about today is what makes us excited about the Philippines in terms of healthcare. Currently, we're performing services that are increasing in complexity. Now, why is that important? Well, as we started this business in the Philippines about 4 years ago or so, you can switch to the next slide if you wouldn't mind. The importance was really around what companies looked at as not very complex activities. Important, but not necessarily clinically complex. Medical record review, some utilization management, the ability to do transcription. And I don't mean to negate the intelligence of anyone doing those services, but as you think about clinical complexity, it was really more of a review process and then working with colleagues in the United States. What's happening now is based on the fact that we have a much better understanding of the talent, of the insight, of the compassion, of the commitment and the quality of the clinical workforce in the Philippines, we're able to gain more and more interest in using Philippine clinicians, nurses, physicians, and others in ways to enhance that complexity of capability. How many of you are familiar with disease management? Disease management is the ability to engage health plan or accountable care organization members and helping them enhance their healthcare status in areas such as diabetes, congestive heart failure, chronic obstructive pulmonary disease, etc. Now, in order to do that, you have to be able to get the members to be motivated to change. Now, any of you who have teenagers know the difficulty in motivation. Okay? You almost feel like, as we call it, catch and release. You get them a little bit, and then they're gone. What we want to do is not do catch and release, but really gain these members in ways that they will really change their behavior and improve their healthcare status. That may mean taking their medication more effectively. It may mean getting the right kinds of tests. It may be able to engage with their practitioner more effectively. What we're seeing is with the enhanced professionalism of the Philippine workforce and those clinicians, we're able to have our clients engage more successfully and more cohesively with that workforce to engage the member, to be able to do assessments, to give them insight and education in terms of enhancing their healthcare status so that they use healthcare resources more effectively, they take more responsibility for their disease, and most importantly, they engage in a relationship with a healthcare coach that has that level of compassion, understanding, and influence to change the behavior of that member. That's huge. And the Philippine workforce, those clinicians have that ability to do it. It's also true in case management. Disease management deals with things like diabetes, chronic obstructive pulmonary disease, congestive heart failure. Case management is even more complex. These are individuals who had the unfortunate experience of a catastrophic illness or may have been involved in an accident. And these members now need to have full engagement of community resources. They need to have engagement of their family, higher levels of relationship with their providers. They may need transplant help. So now that workforce that has come up through levels of sophistication is engaging those members more effectively to be able to do that. And then finally, it's not just group health that we're talking about. It's also disability, short-term and long-term disability. For those of you who are familiar with short-term disability, those are conditions where you might be off work for 6 to 8 weeks. It might be a fracture, it might be a kidney transplant, it could be something having to do with family medical leave. But the important thing is to engage that individual, that patient, in ways that allows them to mitigate the migration from short-term disability to long-term disability. It means getting those people the right resources. It means engaging them in work and helping them find the right level of work within their company so that they're willing to return to work and not get into long-term disability, which has a much higher psychological and economic cost. And then there's also workers' compensation. For those of you familiar with workers' compensation, if someone's injured at work, they have the choice of going to any willing provider to get their clinical care. That may mean going to an orthopedist who says, well, you know, you were injured at work, you have back pain, we can do surgery tomorrow. Well, that's not the way to do things. There's physical therapy, there's emotional support, there's psychological support. And those kinds of things we have our staff doing now to help reduce the cost of workers' compensation, most importantly, get that person back to work. So if you think about the dynamics of what's happening in the Philippine clinical setting right now, it's moving from lower levels of acuity management to higher levels of acuity management to increasing complexity with really strong, compassionate quality outcomes. Now, the other aspect of that is analytics. You need to understand the population and the individuals that you need to go after, in a sense, to reduce that clinical risk. You need to measure the results of your intervention. So in other words, if I'm a physician working with you, the results are not going the way they should, I need to know why. Is it lack of compliance? Is it difficulties with communication? So as we add an analytics overlay to the work we're doing, we have a much better understanding of which populations need attention, which individuals need the most attention, and why. And then, are the results of our intervention making a difference? Not only from a clinical standpoint, but from a financial standpoint. So my testimonial to you today is, we started slow. We grew with organizations that are in the top 50 of health plans. We've added increasing complexity. We are not only doing good work, but those people who are working with us in the Philippines are doing good works. They're improving the healthcare status of individuals, and they're doing that in a cost-effective manner. They're doing it with compassion, they're doing it with quality, they're doing it with commitment. And finally, we're adding a level of analytics to demonstrate the value of those interventions in ways that have never been done before. So this is why I'm excited. And this is why I'm encouraging you to think about the clinical workforce in the Philippines in ways that you may not have thought about before. I had not had the experience of working in this kind of environment up until about a year ago. And I couldn't be more proud of the people that we're working with in Manila and in Cebu. It's a privilege for me to work with them. And the other aspect of what we're doing is education. So to retain this kind of workforce, it's very, very important that we set the parameters of enhancing their ambition, their skill sets, and their retention. Because once you've trained a group of people like this, they're very much sought after by other organizations. So we've developed a healthcare academy that teaches these individuals not only about motivational interviewing, about clinical strategies, but also helps them understand the managed care environment in the United States, helps them give broader understanding into analytics, and also teaches them the value of the work that they are doing, which is extremely important. I have a title besides being Chief Medical Officer, and this is the title my wife thinks is a little unusual. I'm a Chief Mentor. And I'm the Chief Mentor for our Healthcare Academy. So as we develop curriculum and insights, we go to our clients and ask them what would be the most important things for our staff to learn. And within that, we develop curriculum to help them understand, develop, create a stronger understanding of the work that they're doing and the value that they're doing. So the message I want to leave you with today is that this is a tremendous workforce who are passionate, committed, have a high quality focus, they are extremely compassionate, and they do great works. So if you have the opportunity, I'd be glad to talk to you about that, but I think we should all be very proud of the work they're doing, and I look forward to a very strong future across those capabilities. Thank you very much.
We will We will now have a panel discussion on the health information management industry of the Philippines, and we will hear it from some of the companies that are here today. To moderate for us in this panel is Mr. Jojo Ligan, who I had the opportunity of working with back in London when I was posted there. We organized an event similar to this on the contact center industry of the Philippines. Incidentally, Jojo is the executive director at Contact Center Association since 2003, and I believe he's the first and still is the dynamic executive director. He is a highly experienced and accomplished call center consultant, a sales and marketing expert with outstanding interpersonal and problem-solving skills, with an extensive background in the following broad-based competencies: corporate sales, business development, account management, marketing and operations, and management consultancy. He spearheaded the membership growth of the association and increased its profile, influence, and reach through the country promotion and various networking and learning events. So, ladies and